Is going to be on dry needling. So if you've been kind of curious about what it is, how I use it, all the things, this is the video to watch. So let's just start with what dry needling is. So we use acupuncture needles, and I have my little needling cart here. You can see all the fun things. So it uses acupuncture needles, which what that means is it is a monofilament needle. So rather than like when you get your blood drawn or get an injection, those needles have a hollow space in the middle of them to allow exchange of fluid, either drawing blood, pushing medication in, an IV, whatever. So they're thicker. The monofilament needles, it's just one single piece of steel, so there's no hollow space in the middle, so it's much smaller, thinner, and it doesn't feel nearly the same like when you get an actual injection. So when I have patients come get dry needling, or we decide that that's going to be helpful for their plan of care, it really is minimal pain. I tap it in, and I'll demonstrate here in a second, but I tap it in. So on the surface of your skin is where those sharp, dull sensors are. And so when we tap it right past the skin, really the bulk of what you feel is like the dull, crampy, achy sensation when the needle goes through the trigger point. So sometimes it's called trigger point needling. The term dry needling came from research that was done initially. They were trying to figure out what medication was the most effective being injected into a trigger point, which is like a knot of muscles. And so what the research showed was it didn't really matter what medication was injected. It was just the actual needle going in, hence the dry needling, because there's no medication. And obviously a physical therapist would not be able to administer medication via a needle. That is outside of the scope of our practice. So you can use it a couple of different ways. The needle can either be inserted and left static, or it can actually be pistoned in and out. And so it depends on the muscle we're doing, if it's the person's first time doing the dry needling, or did that just thumbs up? Oh, oh cool. Or if they have had this done before. So I'm not going to be super aggressive with somebody the very first time they're having this done, just because I don't want it to be uncomfortable at all. So let me demonstrate on my little banana, because I cannot needle myself. I can't do it. I don't know. It's something about inflicting what potentially could be discomfort to yourself. I don't know. So I have you can see, this is an acupuncture needle, and open it up. Now, obviously, if it was a person, I would have gloves on and sterilized and all the things, but for time's sake, we're skipping all that. So it comes in this little plastic sheath, and you can see the end sticking out. And I'm going to kind of break the seal, and then that is the needle. So if you can see, it's super thin. And so what we do is, see if I can do this in the camera. So I've got the banana. So normally I've palpated on the person, found the big kind of angry knot, and then the plastic goes on their skin, and then I tap it in and then pull that away, and you can see how the needle is kind of in there. So a static needling would be where we just go in. Now obviously this banana is not very thick, so I can't push it all the way through. We can just put it in and leave it static. We can just leave it like that, or attach stem to it so they look like little jumper cables. Hold on. It's hard to do one-handed. They look like little jumper cables. You can kind of see, and then we would clamp that onto the metal. And obviously, because metal conducts electricity, when we put another needle somewhere else, that electricity is going to go down to the needle, find its friend, and then come back up. And so this is much more effective than like a TENS unit, which is just electrodes on the surface, because we are getting all the way down to those much deeper structures. Especially, I do a lot of dry needling in the hip, like on the back, in the glutes. There is a lot of tissue before you get to those really deep layer of those hip muscles that's right next to the pelvic floor. And so this is a great tool to get rid of hip tension, and really just relieve a lot of pain that can't be treated as effectively from the surface. So this would be like static needling. And then let's see there, if I use my shirt for a background. Or you can actually do pistoning, where you kind of move it in and out. Typically I change angles. It's kind of hard to do in a banana, but you get the gist. Honestly, I find the dry needling super effective for relieving muscle tension. You know, it may take me 10-15 minutes to work out tension wise with my hands, can knock out with the dry needling in a matter of 10 to 15 seconds. The beautiful thing about the dry needling is it helps kind of reset your nervous system and what is dictating how much tension that muscle holds. So a lot of times when I describe it to patients, I say it's basically like hitting Control Alt Delete on your nervous system with how much muscle tension it's holding on to. It can have kind of a global relaxation effect. Sometimes people will actually get kind of sweaty or even just a little bit nauseous because of the nervous system involvement that comes with it. It's definitely not for everybody, so there are some contraindications, which I won't necessarily go into on here, but that's the patient and I have that conversation to see if it's going to work for them. But I would say the vast majority of people find it super, super effective, and it's a great tool to be able to have for lasting relief. So that's all on dry needling. Let me know if you thought this video was helpful, or if you want to see like a different demo. Next Monday's Lunch and Learn is on pelvic floor PT versus just doing Kegels. So I thought I could kind of go over what an evaluation looks like, give you a little tour of the room just to kind of maybe help alleviate any sort of like nervousness that somebody may have if they're on the fence about, why do I need to come see you when I can just, do Kegels, or Google told me to do this. So I'll kind of talk about the difference between what a visit here looks like versus just what Google maybe told you what to do. So, all right, have a great Monday.